Good afternoon, ladies and gentlemen, and of course it's very pleased to have you here at the 41st Annual Cancer Control Society Convention at Labor Day weekend 2013 at the Sheraton Universal Hotel. Our next speaker is Dr. John Bergman, and just a couple of comments I'd like to make about him. He's going to talk about arthritis, as you can probably tell from the screen, and I do refer you to the biographies. A couple of things that caught my attention is of course he's very well experienced and teaches in human anatomy, and he's also a guest instructor for Japanese Chiropractic Association. And interesting to me because the Cancer Control Society's had 19 conventions in Japan, and I think the other one was and I forget. Anyway, you're best-selling author, you have a radio show, a blog talk radio show, and you see over 800 people a week, and you're in Huntington Beach. So Dr. Bergman, again, thank you very much for being here. And tell us about arthritis, because it is so common today.
Yeah, and let's just reverse it. Thank you so much for inviting me. I've been an attendee to the Cancer Control Conference for about 8 years. But to actually show up and be offered, it's like, oh yeah. Okay, well, I want to start off by giving everybody a free gift. Okay, wouldn't that be nice? If you have one of these really cool things, my kid showed me how to use it. It's a cellular device. If you text EXPO to 58885, I'm going to give you 4 videos that show how to open and close joints and to regenerate cartilage and how to, just reverse degeneration. I know, because you know what? Most of my talks are about 2 hours long. Yeah, I got 20 minutes. Okay, we're not going to have a long time to go into it, but that's going to be a good gift, and I'll put this up later. Now, here. Oh, good. I found out. What got me into this? Okay, now here I am. I was 30 years old. I was hit by a car. I had both my legs fractured. My sternum fractured, my skull fractured, my liver and heart bruised. Okay, tons of medication. So thank God for modern medicine. In emergency medicine, they're the best in the world. For healthcare, they're horrible. The history is just bad. Okay, we're going to go over that, but you got to know, when I talk about tissue regeneration, I speak with incredible authority because I've been there. I know what it takes to recover. I mean, they told me that I wouldn't get better. They said, no problem, we'll do a couple more operations, you'll be okay. Well, after the first operation, I felt better. Second one, I didn't feel too good. Third one, I felt worse. Fourth one, I felt worse. Guess what they said? Don't worry, a couple more operations, you'll just be fine. And so my mom taught me common sense, and I started to think, well, they're not putting stuff in. Every time they do an operation, they're taking stuff out. So it didn't make sense. Well, luckily I was being adjusted by a chiropractor at the time, and he says, no. You ever cut yourself? The body heals. So joints can heal too. And that's not taught about. It's not taught that your body can regenerate. So we're going to go over that. Now, I've written a couple of books, okay, in how to recover from fibromyalgia, how to correct high blood pressure without medications, because this is the sickest species on the planet. As an animal species, we should be able to self-regulate our body functions. No, you're not supposed to go, wow, never heard that before. No, we're supposed to be able to regulate our cholesterol, our blood pressure, our heart function. We do those things automatically. We're not the only species that can't do that. Now, here's a group of Japanese bodybuilders, because if you've been told that your joints are wearing out because you're old, that's a lie, and it's absolute ignorance. To be one of these, I can't even join this bodybuilding group because you got to be 75. I got to wait 21 more years. Okay, so when you look at this, you got to change your perception first. I had a couple of people come up to me and they say, well, what does it take to reverse arthritis? I said, first you got to change your mind. Okay, when you understand that your body is constantly growing and changing. Like, this is essentially a joint structure. It's two bones coming together surrounded by a joint capsule. Now, and that's just about every joint in the body. But when we look at this, how old are your joints? Okay, don't answer yet. Okay, let's think about this. So how old is your blood? Your blood is only 120 days old. Your skin's about 28 days old. Your joints are about 14 months old. So if you can change that perception that your body is constantly regenerating. I mean, you could take a hunk of the colon out, sew the two ends together, and go in 24 hours later, you won't be able to see the joint. Okay, the body regenerates that fast. So I don't care if you're 30, 40, 50, 60, 70, or 80 years old, your joints are only about 14, 15 months old. Okay, so, and we're going to go over it because people come in and they say, oh yeah, I got arthritis because I'm old. No, you don't. That's not how human beings age. So what we got to look at this is the cartilage is the protective coating on the end of the bones, and that gets its nutrients from the fluid inside of that joint. Okay, now I'm going to fill my elbow up with fluid. Okay, I want you to watch this, because right now, because if I left it bent like this, it would dry up, desiccate, because the lack of movement causes it to not fill up with fluid. Wait, did I do that too fast? Because I'm expecting to hear, wow. So I'm creating a negative and a positive pressure in the joint. A negative pressure allows that superfiltrated blood called synovial fluid, which actually neutralifies the cartilage, to enter that synovial membrane, that covering on the outside of the joint. So it turns out that moving a joint causes it to get healthier and better. Okay, I know, you can do this, this really works. But also just walking, that opens and closes the joints. We have to look a little bit deeper into this, particularly the joints of the spine. I'm a chiropractor, and since the nervous system controls and coordinates every function, spine's pretty important. But discs of the spine can regenerate, and I'm going to share with you a couple of cases where you'll actually see the discs regrow. Now, I have an orthopedic surgeon as a patient, and I told him this, and I said, discs regenerate. Really? I've never heard that before. I'm going, wait a second. Dude, you're a surgeon. You know, you should be, aware that the body has this regenerative capability. And then I started to think, what therapies do they offer? Do they have respect for the body, that the body can regenerate? Okay, and they don't. And luckily, he came to me because his hands were going numb. And the nerves that come out of the neck supply the hands. So luckily, we were able to help him. And if anyone ever owns a diagnosis, neuropathy, and this is what most medical conditioning of the public is, we hold Latin terms, so that way doctors appear a lot smarter. Okay, neuropathy doesn't exist. Nerve problems do. Okay, but if you say, oh, I got neuropathy, just fix it. Okay, this is a pattern here. It's called a dermatomal pattern. It's area skin supplied by a specific nerve root. When you realize this, that if you have a pinched nerve in the neck and somebody says, yeah, doc, it radiates right down here, I know that one. That's the sixth cervical nerve root, right at the base of the neck. Let's see if we can regrow that. Doc, I get this pain going right down the back of my leg to my knee. No problem. That's the third lumbar. I can help that. It's like reading a set of building plans, isn't it? So to think that neuropathy exists in anything other than compressed discs affecting the nerve root, that's foolishness. And then it even gets worse. Discs are alive. Discs are alive. And I've had doctors come in and say, no, discs don't regenerate. Really? So I got 53-year-old tissue on my body? That doesn't make sense. And plus, too, it's not scientifically accurate because I'm going to actually show you discs regenerate. Discs are alive. You don't have any dead tissue in the body. And I had to explain this to the surgeon. I said, discs are alive. You don't have dead tissue in the body. And he said, well, I've never heard that before. And then you start going in. Do you have dead tissue on the body? No. Okay, so if it's not dead, it must be alive. Okay, good. Thanks. Okay, so if it's alive, it's got to take in nutrients, produce proteins, and eliminate waste products. That's all cellular functions. That's what the body's got to do, so it's got to work. And sure enough, if you change the force loading on it, or the pressure on it, it regenerates. The problem is the disc way at the base of the spine, they're under such tremendous force loads, okay, that if the blood vessels would be crushed. I mean, watch this. You're talking about a 220-pound guy. If I go, what's the pressure on my disc like? Tremendous. Okay, if I'm diving into a paintball bunker trying to shoot one of my kids, it's a sport. It's not aggressive parenting. But I mean, the pressure and the force loading is going to be tremendous. Well, God designed that into the body. So the discs at the base of the spine, in fact, all of the discs, they get most of their nutrients through imbibition. So to regenerate the discs, just like Dr. Swilling was talking about, we've got to make sure the blood is healthy and alkalize the system. Now, this is a side view of a low back x-ray, and you'll see, oh, this is so cool. It's like Star Wars. That is a normal disc. That's a normal bone. Those discs are very difficult to see. Now, since discs are about 14 months old, a year later, you can see the discs regenerating. 2 years later, reversal of stenosis, regeneration. Now, you're supposed to say, wow. Good, that's better. Because if you realize that your body is designed to consistently regenerate, you just need appropriate nutrients, appropriate movement, and appropriate nerve supply. This is how the body regenerates. It has to. I mean, there's certain laws that we have to live within. Now, the medical world is really big at labeling stuff. Okay, and it's kind of foolish because all of this is just your body's response to environmental stimulus. The most common type of arthritis is called osteoarthritis. It's supposed to be degenerative, even though it's not. It's actually protective. The type of arthritis that's really getting popular now is autoimmune diseases, like the rheumatic diseases, lupus, scleroderma. And this is interesting because this is the body attacking itself. Now, what type of therapies would cause the body to attack itself? Vaccinations, yeah. Medications, yeah. See, this is something that the human species has never seen before. If you look before 1940, there's almost no mention of it. It's so rare. Now it's the fourth most popular type of disease where the body's attacking itself. So in the rheumatic diseases, you've got to look at it as an immune system dysfunction, not as a condition. Okay? Now this gal, and there's a normal x-ray on the right. That's why I put normal on top. This 12-year-old girl comes in on the left. And now her neck does not look normal, does it? It's straight, it's forward. She comes in with a horrible diagnosis, fibromyalgia and rheumatoid arthritis. The only way to identify rheumatoid arthritis is through a blood test, and it's got a positive RA factor, I mean, which is just a snapshot in time. I mean, when you look at the live blood cell analysis, you know that you can change a blood test. And her mom wants me to put her on disability. I go, disability at 12? What if we just take an x-ray and see if we can't fix her? So sure enough, we go in there. Within 90 days, she gets a negative RA factor, so now she's been blessed. She no longer has it, according to the medical profession, and no more joint pain. And it's interesting because she got over fibromyalgia, got over rheumatoid arthritis. Her mom, about 2.5 months, after the kid had no more joint pain, calls me up in a panic and says, she's hurting all over. And I go, really? What was she doing? Oh, I've never seen her play like that. She was running around playing and jumping all day long. Okay, you know why. Okay, get her in a hot bath. She'll be fine. Don't worry. Okay, yeah. She's just normal. So now these are 3 grades of arthritis. Grade 1 means that you're missing the natural curves. Grade 2, you're seeing beginning destruction of the discs. Grade 3, you're seeing advancing destruction of the discs. If anybody says this is from old age, kick him in the shins, do something, because this right here, that's degenerated. You can see that? Okay? Those bones are different shaped than the ones above. Okay, so that's what they're calling arthritis. If somebody says it's from old age, really, how old are those discs? Oh, they're the same old age. Okay, they're about 14 months old. So I don't care if this person's 75 years old, those discs are about the same age. So that is not degeneration, that's not from age, it's from an abnormal mechanics. Now, all doctors know this. I mean, you see the person on the left. I mean, that's ideal, but you work with the person on the right, don't you? You've seen her in the malls. What that body posture is, that distortion of the body posture, is the body trying to adapt to abnormal nutrients or abnormal function. Now, do me a favor, because we're going to do a little experiment. Sit up nice and straight in your chair. And all I want you to do is round your shoulders over. Just round them over like that, okay? Like that person on the right. Now take a deep breath in. Okay, now sit up nice and straight. Take a deep breath in. Isn't that a trip? I mean, do you think that? Yeah, oh baby. Okay, so the person on the right is going to have to work harder to get oxygen to the brain. Yes or yes? So that person on the right is going to require a higher blood pressure than the person on the left. So it would be beyond foolishness to give that person on the right a drug to lower their physiology or alter it to the one with the normal structure. I know, isn't that cool? Yeah, so let's change that. So a lot of doctors are giving medications for things that they shouldn't. Voltaire was right. Doctors are many prescribed medicines of which they know little to cure disease, of which they know less, in human beings which they know nothing. Could we cover up the date and still have that accurate? Absolutely, absolutely. This is our future. Now, assisted living centers, I would like to close them. Okay, they're probably a good place somewhere. This is not your future. This is a 93-year-old yoga instructor, okay? That's normal. That's normal. This is sick, okay? The body shouldn't be that way. His joints are only 14 months old. Now, this is one of my patients. You can see the x-rays. Horrible. Bent all over to the side, everything disgusting. This is what he came in with. 10 medications, and that's common. I know this is weird because if they ever play these tapes in like 20 years, they'll say, my gosh, they gave toxic chemicals to alter physiology, and they call that medical care? That's insane. So within 90 days, his blood pressure was normal. Yes, off of all his drugs, and we just reversed the arthritis. Why? Yeah, because that's potential. It's just human being potential. I mean, this right here, Tylenol and nonsteroidal anti-inflammatories, there's Aleve, Motrin, I mean, all of them. They inhibit proteoglycan production. That's the building block of cartilage. If you get a doctor that's prescribing a toxic chemical like that, I mean, it violates biologic law for one thing, but it's stupid. This is going to destroy your cartilage, but by gosh, you'll be comfortable while you take it. That's ridiculous. Well, you know, it is going to damage other things too. You know, like Tylenol is the deadliest drug in America. It'll destroy the liver. But here, if anyone's ever taken biomechanics, and I taught biomechanics, this is out of the Biomechanical Bible. Okay, it's called Kirkcaldy and Willis. These are some medical doctors that are just geniuses. Elderly joints prove to be just as strong as the younger ones. Degeneration is a mechanical characteristic of scar tissue. So when they say osteoarthritis, that means the joints are inflaming. That's not right. We know it's not inflammatory arthritis, although we call it that because it's what's always been called that way, even though it's not. So if it's scar tissue, and we've got cells that can eat up scar tissue, let's stimulate those cells and reverse the degeneration. Yes or yes? Good, yeah, because the body... Now this is sick, okay, epigenetic control. Several of the doctors up here are talking about it, and it's true. You can control gene expression. However, these drugs here, the cholesterol-lowering drugs, and the beta blockers, I just read an article this morning that beta blockers, they followed a group of women to lower their blood pressure for 10 years, 2.5 times increase in breast cancer if you took a drug to lower your blood pressure. 2.5 times increase. But this is virtually every drug you got out there. And what they say is, if you take a drug to alter your physiology, heart disease, what's that second one? Cancer, okay, mental disorders, obviously, yeah, I mean, you know, our society is just ridiculous now. So consequences for modern medicine are profound, since it would apply our current understanding of pharmacology as an oversimplification. Understanding of pharmacology? You're altering physiology with a chemical and you think this is good? No, that's ridiculous. We've got to develop more respect for a human being. This blood cell on the right is beautiful, carries oxygen, everything else. This is if you eat a tremendous amount of polyunsaturated fats, have a toxic deficient lifestyle, have genetically modified foods, the blood vessels get sticky, they glue together. Blood vessels don't clot in the arteries. They do clump in the arteries. Now, if you got to push this thick blood through, what do you think has to happen to blood pressure? It goes up. Oh, okay, good. So if you slow the blood pressure down, you're going to get a better reading on a machine, but you're decreasing nutrients to the joint. Okay, if you're slowing the blood pressure down by taking it, you're slowing the heart down. Do you think that helps with oxygen or slows it down? Slows it down. Okay, so since part of the blood function, okay, is oxygen, nutrients, and immune system, and regulates the pH, are you going to be more acidic or more acidic? I know, see, I'm only given one choice. Yeah, makes it easy. So, I mean, this right here, this is a reverse curve in the neck, and there's almost no disc there. This is in the middle of the neck where the body has a nerve that supplies the breathing muscle, the diaphragm. So try it one more time. Help me just one more time. Take a deep breath in, blow it out. You see the carbon dioxide go? You just alkalinized your system. You decrease your risk of cancer by breathing. Okay, this right here, she had breast cancer. Do you think that the loss of function of her diaphragm or the not complete healthy nerve supply coming from that neck increased her risk of cancer by slowing down the diaphragmatic function? It had to. It had to. At least it was one factor. And sure, poor diet and everything in addition. But if you got chronic pain, because that's a reversal of the curve, chronic pain is going to produce, what's the stress hormone? Cortisol? Okay, if you're in a cortisol-mediated metabolic response, that means your entire system becomes acidic. So this little thing right here is that rock in the shoe. If you don't get that rock out, okay, you're going to be developing a gangrene of the foot. They're going to cut the leg off. This needs to be respected. And yes, that's the disc regenerating. This right here, 65 years old, that's a kid. In my world, we're supposed to go to 120. So I think shit should be out, you know, dancing, but not with this. 8 medications. Okay, we know that this increases cholesterol, or this high cholesterol drug increases the risk of cancer. We know that this one increases cancer. Antibiotics, duh, okay. Indigestion, you're decreasing the acid in your stomach. That means you can't absorb calcium or iron. Okay, then you look at this thing, metformin, that lowers blood sugar, but insulin levels remain high. This is completely ridiculous and barbaric. So let's just fix her. 90 days later, drug-free. I know, it's neat. Now, all of these, I've got over 400 YouTube videos. They're free. Okay? Take advantage of the information. I can't make it easier. Well, actually, yes, I can. Here's 2 ways. You get 4 free videos. I show you how to do it, but understand, in order to reverse arthritis, you have to have a healthy blood supply, so you got to clean the blood. You got to have healthy nerve supply, so you've got to make sure that that spine is clear, so the nerves supply the joint. You have to have healthy function. Like, you're never going to fix a knee injury. Trust me, I've had 2 broken knees, okay? You're never going to fix a knee injury unless you repair the mechanics of the foot, unless you fix the calf. In the calf, there's a beautiful pump that allows fluid to get to the joint. You're never going to fix the knee unless you stabilize the pelvis. And you're never going to fix the knee unless you get the low back working right. Turns out it's connected. But in this crazy world, we think a knee problem involves the knee. That's ridiculous. You got to look at the whole thing. They call it, you know, holistic. No, it's just common sense. Okay, does that make sense? Good. And I did it with 32 seconds left to spare.
Dr. Bergman, I want to thank you. Thank you for being here.